Good evening, dear doctors, and welcome to the inaugural conference regarding Philippine Digital Medicine Society. So, I'll be lecturing for today regarding telemedicine, and I think we will be starting right now. Okay, so again, good day. I am Dr. Ivan Cudal. I'll be talking about engaging patients with regards to telemedicine. What will be my topic for today? So, points of discussion. So, what is telemedicine exactly? The advantages and disadvantages of using this newborn, if not newborn, platform here in the Philippines in engaging patients. No, steps in how to do this telemedicine and about some tips regarding my experience to online consults. Okay, so this is just my story, guys. I started telemedicine just last year since the start of pandemic, no. So before I was doing or asking my patients just to email me before or if they have some questions regarding their diseases. Eventually, they have hard time trying to contact me, so I built up a social media page just to have them ask me some questions with regards to their problems. Eventually, while I've been using this social media to produce content and also to cater to my patients, some ask if I do some online consults, and well, here I am today. So fast forward to at least 1 year, I've been doing online consults since. So pretty much still a baby in trying to do this new frontier in consults with regards to our patients. But as a lecturer for today, I'll try to give my insights in how to actively manage our patients with regards to online remote consults. Ayan. So, first up, telemedicine. So, according guys to Google, di ba? Yun pa rin yung pinagbabasihan ko, no? So, telemedicine is a remote diagnosis and treatment of patients using telecommunications technology. Guys, it must be differentiated to telehealth. Telehealth is a broad range of advice or experience with regards to the patients and the audience because telehealth comprises of non-clinical scenarios. Basically training, advanced education, admin work. Those are the things that comprises of telehealth. So what we are doing right now with the advent of social media education, or be it from the Facebook, YouTube, Twitter, or even Instagram, 'di ba? So, and also TikTok, 'di ba? Yun yung mga nakikita nating platform today with regards to um, disseminating information or medical information can be classified as telehealth. Okay? What we are trying to do right now is if we have some consults with direct patients, okay, virtually, that is the what we call the compassing of the telemedicine. So in general, guys, the telehealth is a broad spectrum of services with regards, but if you want to have the online consult only, it is considered as a telemedicine. Now, what are the disadvantages and advantages of using these kinds of platforms? So, basically, I've just written some four of the most important things that is more or less helpful in um, having to know if you can be as a doctor do this telemedicine. No? So, first up, the convenience. So, any patient can have this convenience because they can have their checkups at the um, safety of their home, di ba? So, they can take place anywhere. Me, yeah, I'm currently here in our one of our rooms in our house, so I can do some um, telehealth or tele medicine or online consults just wearing shorts. So even though I'm still wearing a good shirt here, I'm still wearing shorts downstairs. So I'm not obliged to be ano ba, um, properly attired with regards to online consults. Now, one thing also is the accessibility for every patient, no? For the myriad of a number of already doctors who are on telemedicine already, they can have the accessibility even if it's emergencies. Guys, remember, before I have known the telemedicine usage also only for non-emergent cases. But lately, they have been some kind of um, problems that we can answer with regards to emergency cases. No? But it's more or less case-to-case basis. Okay, so what about time? For patients, diba, most of our patients don't want to wait so long in the clinics or in-person visits. This telehealth or telemedicine platform makes us or makes them be convenient with time because syempre 'di ba medyo ayaw nilang naghihintay po yung mga pasyente natin with regards to. And of course, pag titingnan mo with the scheduling of the available doctors with their available time, titingnan nila ano mas gusto nila, hapon ba, tanghali, or kahit gabi po. From the different availabilities of these online doctors, pwede silang makapili kung ano yung meron sa kanilang oras. Again, one of the most thing is their safety because of what is having right now with the pandemic, di ba? They want to be seen or they want to be heard, guys, in just the safest place in their home. So, ito yung mga titingnan natin, less chance of contracting some infectious disease just like what's happening right now. And of course, syempre kung less yung time mo para pumunta sa mga hospitals, less din yung time nila with regards to transportation time. So, and last but not the least, of course, kapag marami ring mga doctors with regards to telemedicine, they have their own choice to pwede sila mag-seek ng first, second, third, or pang-nth opinion pa nila with regards to their problems. Okay? So, be it the patients or sa atin din, pwede tayong mamili kung tatanggapin ba natin itong patient na to with regards to their concern. Makikita natin yan. So, these are some of the advantages in having an online consult or telemedicine. So, what are the disadvantages nga ba? With regards to disadvantage, same thing. Ano ba yung convenience ng tao? Ano yung magiging disadvantage niya? First up, technical capabilities or training. For me, guys, as a doctor, syempre, medyo bata-bata pa na nakikita ko na nagagawa ko po itong training natin or technical know-how with regards to telemedicine. I have my camera here, I have my laptop here, but in general, since I've started my practice, I've been doing not a pen and paper consults, diba? So, ang SOEP natin nandun lang sa paper dati. Ngayon, all of them are in my computer. So, most of the time, medyo sanay na po ako with regards to that. So, kailangan, as kung sa doctor po kayo before na mas sanay sa pen and paper, kailangan medyo mas masanay din kayo how to type or how to listen to your patients with regards to writing down their concerns. So, again, time, okay? Sa physical clinics natin, we can manage or dismiss patients or overall the clinic visits around 10 to 15 minutes lang. Okay? Mabilis na yun, di ba? Kung minsan. But pag medyo telehealth po or teleconsult or telemedicine, ang ginagawa po natin, medyo mas matagal ng onte. It can take around 30 minutes or more kung hindi mo makokontrol yung usapan nyo ng patients mo. So, because syempre, number one, hindi kayo magkaintindihan ng maayos kasi ganito po, virtual consult lang po siya. And number two, some of the technical difficulties, kung minsan naka-off yung camera or naka-off yung audio nila. And that's another 5 to 10 minutes para maayos nyo both kung paano nangyayari with that virtual consult. So, medyo time-consuming siya in general. Hindi mo pa ilalagay nyo, itatype mo pa yung kanilang mga tawag dito, prescription. So, additional time rin siya para magbigay ng ganon. So, one other disadvantage ay yung safety nga. So, ano yung safety? Kung ayaw mo pumunta with regards to this online consults, ito, yung physical exam, ito yung pinakamahirap sa atin for us as a physicians. So, most of other services, kunyari, like surgery service, di ba? Yung mga consults nila, makakapa mo ba yan kung di mo nakikita? Ito yung mga problems with this. And another thing, personal data. With the advent of the Data Privacy Act and the data privacy of other social media, di ba? Ito yung titingnan natin. Payag ba yung mga pasyente natin na hawak-hawak natin yung mga private information? And meron po bang pwedeng makakuha ng mga private information na to without us knowing. Yun yung mga naging problema natin in the future. So, and last but not the least, siyempre sa choice, if they have the choice to check for the nth time or nth opinion, 'di ba? Ang magiging problem dito is the continuity of care. So, palipat-lipat sila, nagdo-doctor shopping sila, hindi mo rin nakikita na tinignan ka niya for the first time pero hindi na siya babalik. So, yun yung nagiging problem natin with regards to telemedicine. Now, sa haba ng mga sinabi ko, with regards to ano ba yung mga pwede nating gawin, how to engage our patients with whenever na, eto na, nakapag-start na po tayo ng telemedicine practice natin is this one. This is, I think, one of the most important slides that I want you to remember, guys, when engaging in telemedicine. Okay, isa-isayin natin. First up, presence. Okay, when regards to your patient, okay, pag nagkita na po kayo dito, be it nandyan man sa inyo dyan sa virtual consult or in-person siya, syempre dapat nandun po kayo. Please, please, please introduce yourself pa rin. Kasi syempre makikita nila na andito ka, tao ka pa rin, na gusto pa rin nilang malaman kung ano yung boses mo or something. Not just ask them na ano bang problema or how can I help you. Please introduce yourself first pa rin. Kasi doon ka pa rin nila makikita or makikilala kung paano mo ibigay yung rapport. Next, pag sinasabi mo ng presensya mo, yan, makita natin na yung patient mo, kahit nandun lang siya sa kabilang linya, nakikita lang sa'yo, okay, kinakausap mo sila, medyo nagkakaroon na rin sila ng ease dyan. Second thing, what is the patient's needs? Okay? So, every patient have their own issues, di ba? Kaya nga pumunta sa inyo yan eh. Kasi syempre, siguro, most often than not, galing niya sa ibang doktor or nakapagpatingin na siya pero hindi siya nakakapagpa-check up ngayong mga panahon na to because of the pandemic, kaya niya trinay itong online consults. So, yun yung mga most common reasons sila. And kahit na medyo pagod ka na for that day, di ba? Tandaan nyo, yung pasyente po na yan, meron silang problema na dapat nating sagutin. So, with that, I think this is one of the most important thing is dapat malaman natin yung yung tanong nila, malaman natin kung ano yung hinahanap nila sa atin because you can explain the theory of your disease, di ba? Of their disease for that matter, okay? But what they want to know is paano ba ito mapapagaling, di ba? Mga ganun yung mga kailangan nilang masagot sa atin or makuhang sagot para sa atin. Okay? So, most important thing, identify what the patient wants to know for that matter. Ito, yung isa sa mga pinaka-problem natin is listening, okay? Sa online consults, pag nag-uusap na po kayo niyan, usually, dear doctors, medyo madaldal po ang mga pasyente po natin. Kasi, hindi nila masyadong nasasabi yan in person sa mga ibang doctors. Ngayon na hindi nila kaharap yung patient o yung doktor, medyo mas may lakas ng loob sila magtanong. So, kailangan nating maging marunong makinig. So, nakasulat po dito, resist on interrupting. As much as possible, guys. Siyempre, natutunan natin na dapat ililid natin sila dun sa questions or dun sa mga bagay na gusto nating malaman when extracting the history. But as much as possible, guys, try to listen to everything they have to say. Kasi kung minsan po, yan yung mga nagiging problems natin with the other doctors. Nakatingin lang daw sila sa laptop, okay? Never silang nagtingin sa camera or dun mismo sa pasyente when they are talking. So, those are the most important things when trying to engage patient. O, diba? Ito yung title ng topic ko eh. So, try to engage them by looking at them through the eye or from here, virtually, through the camera. Yan. Next thing is empathy. Siyempre, yung verbal or non-verbal cues mo, pasok pa rin yan. Nakikita pa rin nila yung tono ng boses mo. Galit ka or whatever or something. Kailangan, siyempre, kahit papano, try to empathize ano yung nararamdaman nila. Pumunta po sila sa inyo dahil meron silang gustong malaman. Meron silang gustong makitang management. And via giving them the answer to that question in a way na medyo gusto nila, medyo ma-flower mo ng onte na hindi masakit sa loob, okay? Hindi biglaan. Kung minsan, okay? Some patients wants it straight to the point pero most of the time, Pilipino yan. Kung minsan gusto nila medyo around the bush yan. For just a few exceptions, of course, yun. So, yun yung kailangan mong maibigay sa kanila. Feel them that, let them feel that you care or genuinely care for them. And last but not the least, validate. So, ibig sabihin, kapag nag-usap na po kayo, okay, ito yung isa sa mga importante dyan. Pag nag-usap na kayo, nasabi mo na, nalaman mo na yung ano yung tanong na gusto niyang, nalaman mo na yung tanong na gusto niyang malaman. Nabigay niyo na po yung management with regards to your patients. The question is, please, do they have the knowledge, or do they know, or they can repeat what you just said? Because dun pa lang malalaman mo if talagang nagkaintindihan po kayo with regards to your patients. No? Let them explain what your plans, and para kahit paano, habang sinusulat nyo po or tinatype nyo po yung management nyo, nakikita mo kung tama ba yung napag-usapan nyo. Ayan. So, di ba? With regards to engaging patients, this is the most important things, or what I call the pillars of telemedicine with regards to having patients starting your online consult. So, shout out to Academy of Communications of Health for showing us the part of this lecture kung paano nga daw po pinapakita yung mga gantong telemedicine or online consults. Okay, so ginagawa na nga po nito. Ano ba yung mga additional tips ko with regards to managing your patients pag nandun na po kayo sa online consults? Ito po yung mga yan. So, first up, choose one platform. Okay? With regards to telemedicine, di ba? Saan ka ba nila nakikita? Doon ka lang ba parati sa Twitter? Doon ka lang ba parati sa Facebook? Doon ka lang ba parati sa YouTube? Or whatever. Or kung minsan, ano ba yung mga available na mga platform natin sa di ba? So, Serious MD, yung mga ganun po. Usually, at yung mga ibang mga app developers from the pharma companies, di ba? So, as much as possible, try to use one only, okay? Kasi doon mo makikita kung ano yung para sa iyo ba talaga tong online consults na to. Kasi pag nasanay na po kayo doon, then you could try to spread yourself across different platforms. Kasi mas maganda kahit papano, concentrate on that platform and know your patients from that platform and know the availability of the audience. Ganun po kasi yung problem. Hindi katulad sa practice natin in real life, dun sa mga in-persons, try mo mag-clinic sa lahat, di ba? Siyempre, may spread too thin ka nun. Pag ganito lang po, kasi nakakalito, pag paiba-iba rin po. Iba yung taong nasa TikTok, iba yung taong nasa Facebook, iba yung taong nasa Instagram. Siyempre, titingnan-tingnan niyo po yung mga ganyan. Next up, prepare. So, guys, pag ginagawa niyo po yung preparation with regards to online consults, before, kapag may online consult ako, doon ko na tinatanong sa history nila eh. But, what I've experienced, habang hindi pa kayo nakikita online, guys, try to have them answer some questions that will prepare you to answer them in the future. So, anong ibig ko sabihin po nito? Yung preparation, ano na po niya, naka-cut off niya na yung needs tsaka yung listening part. Because of this 5 pillars of telemedicine, gawin mo lang po yung preparation. Kunyari, bigyan po sila ng SMS message or email na ano ba yung gusto mong malaman, ano ba yung gusto mong ma-explain ng doktor mo. Via answering those type of questions, nakakat mo na yung time para makinig sa kanya, nakakat mo na rin yung time para identify kung ano yung pwede niyang or hinahanap po niya sa inyo. So, being just prepared para pag nagkita na kayo, straight to the point na kahit papano yung mga problems niyo, masasagot nyo kaagad or mas makikita niya, engage ka kaagad sa problems ni patient. And last but not the least, tip. Okay? With regards to telemedicine, kung minsan po kapag malakas na po ang practice nyo with regards to online consults, di ba? With regards to this online community, medyo toxic na po yan. Kung minsan, hindi mo magagawa yung prescriptions kaagad, hindi mo magagawa yung mag-reply kaagad sa kanya to the social media, hindi mo rin magagawa kaagad na mag-reply to the other persons kahit hindi mo patients. By having a team, from secretary to your social media manager to a technical committee, habang ginagawa mo po yung online consults mo, maybe it's a tip para kahit paano mas ma-less yung time natin. Because at least mas less yung time po para asikasuhin to, mas mabibigay nyo po yung time with regards to managing your patients online. So, I think that's it. So, guys, remember, these are the 3 things that I advise you when starting your digital practice, kumbaga. Ayan. So, even though this is a non-Philippine-based survey, they have noted that 42% right now, nagkakaroon na talaga ng online consults. So much so na nag-increase pa nga po with regards to pandemic because, di ba, ayaw nga nila talagang pumunta. Sa practice nga, in person, di ba, ayaw na nilang pumunta sa Manila, nagstay na sila sa province, okay? Ganun din po yung mga iba, ayaw na nilang lumabas, nagstay sila sa at home, sa bahay natin, and try to have their consults na lang dun sa kanilang mga other available doctors. And, guys, nice to know also, those who tried online consults before, most likely more than 50% of them will try also to stay at that online consult. Kasi makikita nila yung convenience. Hindi ka na sila hihintay sa clinic, di ba? Talagang prompt yung schedule po nila. Tapos kung bet nila yung doktor, tulad nyo kunyari, di ba? At ease sila when having these kinds of online consults with you guys. So, ang ibig ko lang pong sabihin dito is medyo andito po yung market right now with regards to teleconsults, and it is our job to have us available to them, and paano ba tayo mas mapapaganda yung engagement natin po din via this lecture. Ayan. So, I leave something to you guys with regards to telemedicine. So, yung mga ibang doctors, ano po ba yung meron na? Wala akong camera, wala akong masyadong laptop, meron lang po ako, or cellphone, or whatever. So, most likely, ito yung masabi ko sa inyo guys. Ba? Kung ano po yung meron kayo, mag-start po kayo dyan. Because whatever you have right now is yourself. May pinag-aral naman tayo lahat. Marunong naman tayo mag-laptop, marunong naman tayo mag-computer or something, di ba? Most of the time, that is enough already to have an engagement with your patient. Okay? So, by that engagement with your patient, but most likely, makikita mo na meron ka nang matutulungan na isang tao. And dun sa natulungan mong isang tao, for them, their life have been transformed already by that simple gesture. So, again, yun lang guys. If you have questions and concerns, you can contact me here. May nakasulat pa ba yung mailing address ko from the social media, and of course, our email address. So, I think guys, that's it. Thank you PDMS, Philippine Digital Medicine Society, for having me as your lecturer. Hope to see you in the question and answer portion. Bye-bye.